Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Wednesday, June the 10th, 2020. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory.
Thank you, Brad, and good afternoon. We're at a tremendous moment in our history where people around the world and here in our city are more engaged than ever before in confronting anti-black racism in our society. I want to be clear to the public that this work is continuing in our own city. It was begun some time ago, and I'm meeting with people and listening to people every single day to hear how we can do even better when it comes to these issues in our city government and across the city itself. I hope to have more to say on additional actions we will propose to undertake in the coming days. All of our actions will be founded on our conviction that there is no place for anti-black racism in our city. We have been clear about that, at the same time acknowledging that it still exists in 21st century Toronto and that there has been plenty of anti-black racism in Toronto's past. That has sparked a discussion about Dundas Street and other streets and spaces and installations in our city. I have asked our city manager, Chris Murray, to form a working group of city staff from all relevant departments, including the Confronting Anti-Black Racism Unit and the Indigenous Affairs Office, to examine this issue broadly. Renaming a major street or public space does create many practical challenges, but we should have a process that can examine what are very important and relevant historical questions, along with all of the practical matters involved if such changes were to be made. We do have a street naming policy and a process to rename streets, but I think, in light of the context within which this particular street name has arisen, a broader and more in-depth examination and discussion is warranted. I've asked that we have some specific sense of the direction this working group would offer to us in 30 days, knowing actual decision-making and public consultation could take longer. I'm proud to announce today that we are launching Swim TO and Camp TO programs as part of the ongoing reopening of the city. Swim TO is a quick launch program that will help Torontonians access outdoor aquatic amenities and to cool off this summer. This is our plan to give residents access to outdoor aquatic amenities, including swimming beaches, outdoor and wading pools, and splash pads. The Swim TO plan represents an opportunity to ensure that all Torontonians can safely in many respects, but also within the context of public health, can safely access outdoor aquatic recreation and cool down during hot summer temperatures as the province lifts its emergency orders and Toronto itself begins to reopen. With the approach of hot summer weather and the extended closure of many indoor public spaces, it's vital that Torontonians have an opportunity to cool down outdoors. There are more than 300 city-run outdoor aquatic amenities in neighbourhoods across Toronto, including 59 outdoor pools, 100 wading pools, 140 splash pads, and 11 supervised swimming beaches. So as you can see, it's quite a task to get all of those ready and to open them up when the moment comes. The plan is dependent on the Province of Ontario amending its orders as they relate to the City of Toronto, as we have not yet been included in the Stage 2 changes. We will, of course, be guided as well as we have been throughout by the advice of our Medical Officer of Health, Dr. So the dates for these services to resume will actually be set out by the province as part of Toronto's eventual participation in Ontario's Stage 2 reopening, but we are making plans expecting the orders could be lifted as early as June 19th. While we continue to work to stop the spread of COVID-19, it is also of critical importance that we work to prevent heat-related illnesses at the same time. And one way the city can achieve this is by providing easy access to its outdoor water amenities, together with clear instructions for physical distancing and hygiene for users. These steps will help to ensure the safety of staff and of the public from many different perspectives, including public health. I know there are many people who are eager for these amenities to reopen. I still remember how excited people were at the end of June last year when we opened the outdoor pools. We've already had several heat alerts in Toronto, and there will continue to be more, I'm sure, throughout the summer. Our parks, forestry, and recreation staff are expediting the final preparations necessary to safely reopen all aquatic amenities once we're given the green light from the province. Key activities include, but are not limited to, filling outdoor pools, turning on mechanical and filtration systems and servicing them where required, turning the water on, completing the hiring and training of staff, all of which are underway now. As part of the Swim TO plan, people can expect to visit any of the city's 140 splash pads within a week of the go-ahead given by the province. Outdoor pools and wading pools will follow very shortly thereafter. The beaches have remained open throughout the pandemic in the same way green spaces in parks have been open. The city's Swim TO plan will see lifeguards return to 6 Toronto beaches on June 22nd, with the remaining 5 sites supervised by July the 1st. In the interim, swimming without the supervision of a lifeguard is not recommended at the city's beaches. Toronto has some of the best beaches in the world, verified by the internationally recognized Blue Flag program. Many of Toronto's beaches have Blue Flag status, a label awarded to beaches that achieve high standards pursuant to 33 criteria, including water quality, environmental education, environmental management, safety, and services. During the summer, Toronto Public Health takes daily water samples from lifeguard-supervised beaches across the city and measures the level of E. coli bacteria present in those water samples. This testing program ensures that Torontonians can swim with confidence in Lake Ontario off our beaches. So the goal when it comes to recreational access to water amenities this summer is very simple. Get everything ready so that we can open them up as fast and as safely as possible once we get the green light from the province, with health obviously being at the very top of the list. Now, the province's announcement earlier this week permits day camps to operate, provided they take proper public health precautions. This was the provincial permission we were waiting for in order to activate our Camp TO program, which replaces some of the programs we were forced to cancel a few weeks ago. Today, I'm announcing that the City of Toronto will begin to offer summer camps across the city starting on July 13th. The Camp TO program will provide a high-quality camp experience for children aged 6 to 12. The program will offer traditional day camp experiences, including dance and drama, music, arts and crafts, and active games. In addition to camps offered at parks, forestry, and recreation locations, Camp TO will also be offered at 6 Toronto History Museum sites and 1 of the city's arts centres. Camp TO will offer more than 32,000 registered camp spaces for children between the ages of 6 and 12 over 8 weeks of camps at approximately 150 locations around the city. Unfortunately, due to public health precautions and due to some of the changes we've had to make to these programs because of public health concerns, this will be a smaller program than our usual summer camps. In May, we made the extremely difficult decision to cancel existing registrations for summer camps, knowing that we would not be able to practically offer these programs as structured and as scheduled at the time, given the public health conditions and some of the changes we had to make to comply with public health requirements. My hope is that these modified camps are able to help support families with parents and caregivers who may be heading back to work as our city reopens, families who have been kept inside for such a long stretch, and of course young people who need employment opportunities. Details of the programs will be posted online this weekend at toronto.ca/camps. Registration for Camp TO will take place beginning at 7 a.m. on Wednesday, June 24th for Etobicoke, York, and Scarborough districts, and on Thursday, June 25th for Toronto, East York, West Toronto, York, and North York districts. The quickest and easiest way to register is online at efund.toronto.ca. That's efund.toronto.ca. Phone registration will also be available. Since civic centres and community recreation facilities remain closed, in-person registration will not be available. Residents can call the customer service line Monday to Friday, 8 a.m. to 5 p.m. for help in preparing for the registration. Extended hours of operation from 8 a.m. to 7 p.m. will be offered in the lead-up to registration on June 22nd and June 23rd, with the registration on the days to follow. Summer camps are so important for so many of our kids, and I'm glad that we'll be able to offer this experience this year, even in the midst of a pandemic, to thousands of families. This is a critical piece of our recovery and rebuild efforts. City staff have worked hard to the point where we can offer this program safely, and on behalf of all of the people of Toronto, I offer my very sincere thanks for all the work that they have done in pulling this program together on relatively short notice. I'm sure that many of the parents are looking forward to their kids getting to camp as much as we're looking forward to putting those camps on. A lot of joy will be experienced in many households after this very long winter and spring. Now, I'm also announcing today that through Active TO, we have now delivered 65 kilometres of quiet streets along 32 neighbourhood routes across Toronto. Quiet streets are shared space to allow residents to maintain physical distancing while getting around on neighbourhood streets. Signage and temporary barricades are placed at intersections to encourage slow, local vehicle access only, so that the roadway can be a shared space that welcomes people who walk, run, or bike. Staff have been actively monitoring and adapting all locations based on neighbourhood use and neighbourhood feedback, and have been returning to locations to address on-street issues as they arise. This may include work such as adjusting the size and the placement of the temporary barriers and reviewing the types of barriers in order to support and increase safety. More than 10 kilometres of Active TO major roads will again be closed this weekend. The Active TO programs are all being installed in record time, and the feedback I've heard and seen from many people who are using these spaces has been tremendously positive. I'm glad that we are able to help people to get outside, to get active, while at the same time keeping their physical distance from one another. Summer is always a great time in our city. We know this summer is going to be different due to COVID-19, but summer is absolutely not going to be cancelled. I will do whatever is needed here at City Hall and issue any proclamations required to guarantee, pandemic or not, that we do have a summer in 2020. It'll be a different summer, but it's going to be a good summer. We are doing our best to make sure the city's services that people rely on, like outdoor pools and splash pads and beaches and summer camps, will be there and will be safe. That is our responsibility to do just that. And now I would like to call on Dr. Davila to offer her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 121 new COVID-19 infections in Toronto. To date, 10,310 people have recovered, an increase of 403 from yesterday. As always, for more data on COVID-19 in our city, please visit our website. As the Premier announced on Monday, a number of locations in Ontario are moving forward with the second phase of reopening. Toronto, along with other communities in the Golden Horseshoe, are at a different point in their COVID-19 outbreak and will move to this phase at a later date. However, we are certainly seeing progress here in Toronto with a reduction in new cases and in hospitalizations. And I will keep you updated on our progress as we move forward towards reopening. As we work to reopen our city, my team and I continue to focus on our COVID-19 response objectives: to prevent the loss of life, to preserve our healthcare system capacity, and to minimize the social, economic, and broader health impacts of COVID-19. I continue to receive questions about our case and contact management work and how they fit in with our COVID-19 response objectives. My concern is that people think that case and contact management work is the simple act of speaking with a positive COVID-19 case to identify the people that they live and work with, and then to tell those contacts that they've been exposed to the virus and give them advice on what they should do, the symptoms that they should watch for, and what to do if they develop any of these symptoms. While this describes a part of our work, case and contact management is actually much more complex than this. In public health, our patient is the community. This means for our work in case and contact management, we want to stop transmission of disease. This is why we identify people who've been exposed to a COVID-19 case and advise them on what they can do to prevent further spread. However, the more complicated part is the work that we do to try to identify the source of where the person acquired COVID-19. This gives us the opportunity to work upstream to prevent future virus spread. Upstream interventions deliver a more powerful impact because when we're able to identify the source of a problem or an infection, we have the opportunity to proactively address it instead of treating it and managing it after it has occurred. As you may recall, our first case of COVID-19 in Toronto was identified in January. To date, we have investigated nearly 13,000 cases of COVID-19. To put this into context, in a typical year, at Toronto Public Health, we manage about 45,000 cases of roughly 70 reportable diseases each year. So, not only are the COVID-19 numbers significant in terms of time and scale, also equally important to remember is the fact that COVID-19 is a new virus that we only learned of in January. Taken all together, this has been a truly unprecedented outbreak for us at Toronto Public Health. Never before have we had to manage so many cases so rapidly, all while learning about the virus causing the disease itself. Despite the magnitude of this challenge, we've been putting a great deal of effort into this. Throughout the entire outbreak, my team has risen to meet every challenge and every setback that we have faced, all during an unprecedented global emergency. My team has shown time and time again how dedicated and committed they are, and I couldn't be more proud of them. My team and I continue to be committed to making improvements every step of the way. To manage the volume and pace of the challenge presented by COVID-19, we've mobilized and increased our workforce to now approximately 700 staff supporting the case and contact management function, and we continue to scale up as our situation evolves. This includes partnerships with the Registered Nurses Association of Ontario, the University of Toronto, other local public health departments, and a number of other health agencies. We've partnered with the city to build a new and more effective case management system in an unprecedented 8 weeks in the midst of a global emergency. We've reviewed our own internal case and contact management processes to improve our work in this critical function. We brought in staff from the city's Emergency Operations Center to conduct their own review, their own independent review of our work, to improve our response and to help us prepare for the future. And we've partnered with labs and COVID-19 assessment centers to streamline results sharing and to do everything that we can to make sure that cases and their close contacts are quickly identified and appropriately managed. Our recent data show that our efforts are paying off. While in the past, we experienced delays in case follow-up times, in recent weeks, we have made significant progress in this area. But I think it's very important to explain that there continue to be challenges in the broader health system outside of public health, in things like the way in which results are reported to us and the delays that currently occur within the laboratory system, which in turn result in delays in reporting to us at public health. These areas need resolution. They need resolution from a health system perspective. And my team and I are committed to working with labs, to working with the province, and other health system partners to address these systems issues. We know from other jurisdictions that as people go back to work and to school and interact more in the community, we can expect to see an increase in new infections. I appreciate that many of you are wondering what actions we can take to stay safe. I recently read an article that provided some useful advice, asking readers to consider 4 C's as we move forward: close contact, confined spaces, crowds, and choices. The simplicity of this advice, I think, is really appealing and very useful. So first, avoid close contact. Continue practicing physical distancing, and as much as possible, keep at least 6 feet apart from anyone outside of your household. Avoid, where possible, close contact in confined or crowded spaces, especially indoors. And wear a cloth mask or face covering if that distance cannot be reliably maintained. Be mindful of your choices. We will all make our own personal decisions of how we will act in the coming months. However, I simply ask that you think of others when you make these choices, and to think about the potential impact of your choices on those around you who may be more vulnerable. When outside your home, you may also consider keeping a log of the places you've been. That way, if we need to contact you due to a potential exposure to someone with COVID-19, we're able to work with you more readily to identify contacts and to do that important case and contact management work that we do in public health. It has been an incredible and very challenging journey for us as an organization, right, this COVID-19 outbreak. We have really been flat out since the beginning of this year. I just want to take this opportunity to acknowledge my team, who has been working unbelievably hard, 7 days a week, for many, many weeks now. To them, my sincere thanks. As we continue to move forward, your individual contributions continue to be central to our success. So I ask of you, please, continue to practice physical distancing, and please continue to take care of each other. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. Davila, and good afternoon. Today is the 92nd day of continuous EOC operations in Toronto. We continue to ensure that both critical and essential city services are being provided without interruption, as they have been throughout the COVID-19 pandemic emergency. I'm proud of every member of our team who continues to work hard in support of our residents each day. This afternoon, I will provide our weekly personal protective equipment update. At present, our PPE levels remain stable, and our team continues to work hard to source the equipment that we need both now and on a go-forward basis. Our current PPE inventory levels are as follows. We have a 35-day supply of N95 respirators, a 163-day supply of surgical masks, a 204-day supply of isolation gowns, a 135-day supply of face shields, and a 49-day supply of blood-borne pathogen-resistant medical gloves. Our pandemic reserve stockpile, which is in addition to the current inventory I outlined previously, is as follows. A 628-day supply of N95 respirators and a 740-day supply of surgical masks. As you know, managing PPE has been a constant challenge throughout the COVID-19 pandemic. We have encountered and dealt with numerous quality control and supply chain issues with items of PPE that we rely on. We have implemented consumption mitigation measures for medical gloves until such time as our pending shipments arrive from the supplier. I've been asked by a number of people as to why the inventory numbers fluctuate from day to day and from week to week. As you know, we built and operate a comprehensive PPE management system that includes both live time consumption rates and inventory count dashboard functionality. The amount of PPE that is used from day to day which we refer to as the PPE consumption rate, changes based on emergency response volumes and varying levels of activity across many of our services. As the consumption rates change from day to day and from week to week, so do the corresponding number of days of current inventory that we report. Likewise, as PPE is received and placed into inventory, our days of inventory counts are automatically adjusted. As we continue to transition from COVID-19 response to city restart, we are continuing to evolve and scale our processes and deployment models within the EOC. Now that we are into the city service restart phase of operations, a number of lower demand EOC services are now being scaled back to match demand. The PPE task force continues to be one of the principal demand services that are operating within the Emergency Operations Center, and I expect that to continue as we lead the city through restart. My teams, including the PPE task force, are continuing to support the Office of Recovery and Rebuild as they work with the various city divisions and agencies to bring city services back online. In closing, I want to thank everyone who continues to do their part to help us stop the spread of COVID-19. As always, I remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. Before we go to questions, just to let reporters know that staff on the line include Marianne Bedard from Shelter Support and Housing, Paul Raftis from Senior Services and Long-Term Care, and Janie Romoff from Parks, Forestry and Recreation. First question is to Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Hi, thank you. Hi, Mayor Tory. My first question is regarding Councillor Ford's COVID-19 diagnosis. I'm wondering if he had been in City Hall recently and came into close contact with any other councillors. If so, are there any others in isolation at this point?
I'm not aware of whether he's been to the City Hall or not, to be quite frank. I spoke with him last night, and he said he went to have a test after experiencing some symptoms on the weekend, tested positive, and had isolated himself from the moment he had the test, as properly would be the case, and was now in the process of being isolated and hopefully recovering. And I certainly wish him well in that regard, but I'm not aware of his movements in or out of the City Hall or anywhere else, for that matter, in the time prior to his having the test.
Okay, thank you. And for my follow-up question, it's regarding patio expansions. What happens if a landlord won't allow their tenant to expand their outdoor space? Would a restaurant owner have any other options? Would the city step in if necessary?
It's hard to answer that question because, in fact, the expansion we're talking about here would likely be under the provisions we've put in place on public space, in other words, space that belongs to the City of Toronto. I just hope that the landlords will give themselves a pinch and you know, be more reasonable, as some have not been, on the subject of rent and making sure that these businesses can survive, and similarly that they will be positive and cooperative and encouraging in having bigger patios, because this is not only meant to increase the enjoyment of Torontonians in the summer this year, but is also meant to very much to give these businesses, these struggling businesses, a lifeline so that they can stay alive and hopefully be back in shape before too long with these increased revenues that this will provide for them.
Okay, thank you. We go now to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon. Dr. Davila, on Monday you said cases among young people with COVID-19 were on the rise, and I'm just wondering if you could elaborate on what you've seen in recent days, and also on maybe what the cause may be with this spike in that demographic.
So, Matt, I've had the team have a look at the data in greater detail. We are generally, compared to earlier in the outbreak, seeing more cases amongst a younger demographic. But in fact, when we look at our case information in greater detail, it looks like the highest rates of new infections right now are amongst those who are in their 50s as opposed to those who are in their 20s. So, and the main risk factor that is involved in the newest cases, for the vast majority of them, it's about close contact to somebody who is a known case. And those close contacts tend to occur either within the context of a household or at work. So that's what we have seen as we delve deeper into our case data.
Thank you. And Mayor Tory, you were speaking about the camp program. I'm just wondering if you could tell us what consideration has actually been put into this plan to make sure that there is equal access to these camps, because there will be, as you mentioned, less capacity in them. So what consideration have you put into it to make sure there's equal access, to make sure that all neighborhoods have access and that vulnerable and at-risk youth would also have that access?
That's certainly a concern of ours because, you know, while all Torontonians, upwards, I guess, of 100,000 over time have enjoyed these camps in a circumstance where we didn't have to take account of public health considerations, as we very much have to do now, we obviously want to make sure that also those who might need this help the most, and I made reference to people who are, for example, having to return to work and where they had counted on these camps to provide for them or to help them with the task of their children being occupied productively in that time. Perhaps I could ask Ms. Romoff to elaborate on that.
Yes, Janie, if you could...
Thanks, Mayor Tory.
Go ahead, Janie, thank you.
Thanks, Brad, and thanks for the question. In addition to what Mayor Tory has referenced, the program is available online, so there's an equal access to the registration opportunities. In rolling out the program, we've also focused more substantially on communities that may be more vulnerable and in need of these types of programs from an access perspective. And would also say our usual programs, such as the Welcome Policy, which is a fee subsidy program, is also in full effect for the registration of this program. These are the kinds of policies and programs we have in place all the time, and we'll certainly be continuing to use those throughout this new registration process.
Thank you, Janie. Next question is Simon Dingley from CBC News. Simon, go ahead, please.
Thank you very much. Good afternoon, Mr. Mayor. Hope you don't mind me asking a question of a different topic. Advocates say an unusual high number of people are experiencing homelessness, and they've gone missing in recent weeks. What's your reaction to that and the criticism that the city has not done enough to support the homeless community through this crisis?
You know, if you have one homeless person that is displaced and where we can't find alternate housing for them, that's one too many. But if you want to look at, I think, in relative terms or in absolute terms, what the city has done to help its homeless population, I think the achievements have been nothing short of remarkable. And I want to pay tribute to our staff who have, I think, performed incredible feats in, for example, moving 3,000 homeless people from circumstances where they were not appropriately physically distanced to places where they were. Setting up not one but two safe medically supervised facilities where people who were homeless after testing for COVID-19 could go and be appropriately isolated, where unlike other people who could just go home and be isolated there. And I think if you go on through all the different things that have been done, if you look at the actions we've undertaken in a sensitive, measured way with respect to the encampments, which can't continue for safety and health reasons in our city and a whole host of reasons, but the way we've handled it is to give notice, to go and work with those people, and then the vast, vast majority of them end up in housing of one kind or another, and the encampments are cleared. And so I think there's just achievement after achievement after achievement that put us at the highest standard, I would say, of any city in North America in terms of how we've dealt with our homeless population. Have we managed to resolve every single case of homeless in the city? No, we haven't. Have we done, I think, an excellent job in very trying circumstances to provide for those people? I think we have, and I think that our city staff deserve commendation for that, and the city government as a whole, which has stood behind those members of our staff and put the resources in place to make sure that we could deal compassionately and sensitively and properly with the homeless population. But it's never enough, but I think we've done a really good job in the circumstances.
Simon, I'm going to ask Mary Ann Bedard to add to that if she could, please.
Thank you for the question, Simon. Specific to your question about a number of people going missing, we are aware that...
Speaking on the homeless now.
Yes, so we are aware that there are a number of individuals who have been reported missing. And while it's not unusual for people who are homeless to be out of touch with the system for periods of time for a variety of factors, obviously we hope that everyone who's reported missing is found safe. As was the case with one of the gentlemen who was reported missing on May 7th, 27th. The police in 14 Division located him safe yesterday. So we do keep very close ties with the Toronto Police. We actively maintain a database where we can identify if there is a person of concern, if they reconnect with the shelter system somewhere, either through our street outreach or at one of our many shelter programs, we're able to identify that this person's reconnecting with the system. Additionally, we have Streets to Homes staff that are actively engaging with people in encampments right across the city, and often we are able to locate people that might have left shelter. But this is a very mobile population, and so sometimes people reconnect with family, sometimes people move on for a variety of reasons. So, we do hope that everybody is safe, and we will remain very vigilant to try to identify where these people are.
Thank you, Marianne.
Thank you.
Go ahead, Simon.
Thank you. If I can ask one more question, I know you're talking to police. Is there a concern here that someone may be preying on these homeless people? Obviously, we had a situation a few years ago where someone was preying on people in the gay community.
I would not like to speculate on what the cause of this is. That's why we work very closely with the Toronto Police Department, and we'll certainly take any direction we can from them.
Okay, thank you, Simon. Thank you, Marianne. Next question is to Dave Ryder from the Toronto Star. Please go ahead, Dave.
Hi. This question, I think, for both Mayor Tory and Dr. Davila is the city's child care centers. How are they impacted by the provincial decision? When is it clear as to when and how city daycares can reopen and resume to something like normal service?
Well, I would just say that I've seen, as we have at the Strategic Command table, a full and complete plan put together by our city staff that deals with kind of a staged reopening of those city-run facilities, as well as some that will not be in a position, according to the plan, to open because they're located, for example, inside schools, which remain closed, and that plan will be laid out. I think there's communication taking place now with both, obviously, the staff and others, but also with the families that are affected by that plan, because obviously in the entire sector there are substantial changes that are taking place pursuant to the public health requirements.
And if I can add to that, certainly from the perspective of Toronto Public Health and thinking about what our objectives are on the COVID-19 response, it's a question of ensuring that there are childcare services available. This is an important part, an important component of minimizing the social, economic, and broader health impacts of COVID-19. And clearly, we're interested in ensuring that that's being done in a manner that considers COVID-19 transmission and how that transmission can be minimized in the context of childcare settings. We recognize, however, that as more activity happens in our community and more people interact with each other, there is no such thing as a completely risk-free environment. We have to do the best we can in partnership with childcare providers to create the safest environment, but that doesn't necessarily mean that there will not be COVID-19 risk. I think we just have to be very clear-eyed about that and ensure that we have systems in place to respond to those circumstances.
Thank you. And my follow-up is for one or both as well, which is, Mayor Tory, you called for sort of clear benchmarks from the province on moving to stage 2. I'm wondering, what are the clear benchmarks for Toronto in which we feel comfortable moving to stage 2? And Mayor, did I hear you correctly say that could happen as early as June 19th?
Well, the provincial orders, the way they set them out, said that as early as June 19th, they could make the decision, which they will make, their Chief Medical Officer of Health, to lift their orders or not for the GTA, which includes the City of Toronto. And I'll let Dr. Davila speak to this, but the indicators that are reviewed by her and by us on a regular basis are the same indicators that were set out by the province when they outlined their strategic framework for the reopening of the province some considerable period of time ago. And so those are the things that we're looking at, in addition to others that Toronto Public Health has put in front of us. But I'll ask Dr. Davila to pick up from there.
Yeah, so to add to what the mayor has already said, there is a provincial framework for reopening, and underneath that framework, local medical officers of health from all around the province developed a set of indicators, a minimum set of indicators that we all agreed were important to assess as part of following that provincial framework towards reopening. We are monitoring those indicators throughout the province and certainly here in Toronto, and I will have some news for the public and for our press as well in the coming days around what our monitoring indicators look like to help have that discussion with the public on how we feel things are progressing. I've certainly indicated in my remarks that we are seeing clear signs of progress. I think it'll be useful to have that conversation in the coming days with the public around what those specific indicators look like and how we feel we're progressing towards the next phase.
Okay, thank you. Final question is to Mark McAllister from City News. Go ahead, Mark.
Dr. Davila, wondering if you could comment briefly on the sharp rise in recovery numbers. We've seen more than 400 since the number that was reported yesterday.
So, Mark, I don't know that I have very specific data on that. I'll certainly have to go back to the team to get very concrete, specific details, but suffice it to say that as individuals who are diagnosed with COVID-19 either go through a certain period of time since the onset of their symptoms and or in certain cases go on to have negative swabs taken, that's how people are declared recovered.
And perhaps your thoughts, I know someone had asked Mayor Tory earlier about Councillor Ford being diagnosed with COVID-19, your thoughts?
So my thoughts, well, I, as a member of our community who is sick with an infectious disease, clearly I send him my very best wishes and wish him a very speedy recovery. As you know, we don't talk about the specific details. I'd like to honor his privacy and just wish him very, very well and hope that he has a speedy and uncomplicated recovery.
Okay, thank you very much, everybody. That concludes today's briefing. We'll be back here again on Friday, June the 12th at 3:45 p.m. Thank you.